Magandang araw po muli sa lahat. Olfactory diagnosis pa rin po tayo. Clinical significance. So, clinical significance. Diagnosis by smelling is not a major part of diagnostic process. It is used mostly to confirm our diagnosis and is seldom a clinching factor. The 5 elements, smells, mentioned here are useful mostly to correlate to the patient element type and to indicate accordance with or disconcordance from it. For example, a rancid smell in a wood element is pathological exaggeration of constitutional wood smell and therefore is less serious than another smell would be. Halimbawa daw po kung ikaw ay yung elements mo ay wood, kung ang naamoy sa'yo ay amoy ng wood, hindi masyado itong serious. Pero kung ibang amoy ang maaamoy sa'yo, tulad daw po nito, in other words, for a wood type to have a putrid smell pertaining to the kidney is more serious than for the same type to have a rancid smell. So yun, kung iba po yung maaamoy sa'yo ay mas serious. Halimbawa daw po dito, yung kung putrid smell ay para sa kidney yun. So there are two quite distinct aspects to diagnose by smelling. The first is the odor of the patient's body itself, which can give us an idea not only of the prevailing pattern of disharmony. Odor of the patient's body itself, which can give us an idea not only to the prevailing pattern of disharmony, but also of the patient's constitutional type. The second is the odor of certain bodily secretion, which is used only to identify the prevailing pattern of disharmony. Assuming the patient is not wearing perfume or strong aftershave. So, sabi po niya ng author, at tinatanong daw po yung patient, I normally ask my patient not to use perform aftershave when they come to their first consultation. Opo, sasabihin natin talaga sa mga pasyente natin, kahit na yung pag-lipstick, pag may makeup, wag, para makita natin yung normal color ng mga katawan nila, tapos yung normal din na amoy. Kasi sabihin na, maligo lang sila kung tapos walang ilalagay. Diagnosis by smelling is carried out as the interrogation progresses. In some cases, the body odor is quite clear, even overwhelming. If there is no particular odor emanating from the body at the start of the interrogation. In most cases, it will become apparent when the patient is lying down, partly undressed for acupuncture. Ako pang ginagawa ko pag alam kong may mga refer sa akin na pagpapa-acupuncture or pupunta kami sa community para mag-acupuncture, yung mga center person po namin doon, sinasabihan na namin, yung mga pasyente, sabihan po ninyo na huwag sila mag-lipstick, mag-makeup, magpabango. Ayun. Kaya pag humarap sila sa amin, yung kung ano sila. So, body odor. From a 5 elements perspective, the 5 body odors are as follows. Rancid or foul in Chinese books for wood, scorch, or fire. Yung amoy sunog po yun Fragrant or sweet is for earth. Gluten for metal, and putrid for water. So yun, yung mga pag-gluten, yung mga parang bulok ang amoy Yan. From this point of view, this body odor reflects a disharmony in the relevant element, which may be deficiency or annexes. In a few cases, these body odors are very apparent as soon as the patient comes in. But in most cases, these odors are detected only when the patient undresses and especially on the back. Sometimes, the 5 elements body odor emanates after the needles have been in for about 20 minutes. In my experience, the 2 most common 5 elements body odors are the putrid. Yung putrid po, yung parang amoy bulok din yan, sa kidney yan po yan. And rancid, yung parang maasim. liver. So once the putrid odor is relatively common in the elderly, yung mga medyo maitad na. Kasi nga, presumably due to decline of kidney chick. Kaya gano'n na ang amoy po nila. Dahil nga humihina na yung kidney chick, hindi naman sila amoy block. Pero basta parang kakaiba na po yung amoy. So the body odors can be used diagnostically in two ways. In the absence of pattern of disharmony, accounting for a particular odor, the body odors reflect the patient constitutional element type in the same way as the body shape and facial structure do. Thus, a slightly rancid odor will emanate from a wood type. A slightly scorched one from a fire type. In addition to the constitutional body odor, a person's body odors reflect the patterns he or she is suffering from. Yung pag naamoy na ninyo yun at alam nyo yun yung organ nung amoy na yun, mabilis yung iyong pagda-diagnose. And this may not necessarily occur with the patient element type. For example, a wood type may emanate a slightly scored smell. Yan. Yung parang sunog na amoy yan, indicating the presence of heart pattern. Indeed, if the body odors contradict the constitutional element type, this is a bad sign. In other words, it is worse for a wood type to have a scorched odor. Yun nga yung sinasabi natin kanina, na kung wood type siya, dapat hindi yun yung amoy niya kasi yung scorched odor ay para sa heart than a rancid one. So, 5 elements po. Yan, rancid, wood, scorched fire, fragrant, sweetest, earth, rotten, metal, putrid, water. Odor of bodily secretion, yung breath. The odor emanating from the mouth is closely related to the digestive system. Generally speaking, a strong and pleasant breath indicates stomach heat or retention of food. A sour smelling breath indicates retention of food, or in children, accumulation disorder. A foul and somewhat pungent breath indicates damp heat in the stomach and spleen. A rotten smelling breath may indicate damp heat sa large intestine po yun. So, which may be due to ulcerative colitis. Breath smell. So, summary po ito, strong, foul stomach heat or retention of food. Sour, retention of food, accumulation disorder in children. Pag foul, pungent, damp heat in the stomach and spleen. Pag rotten, damp heat in the large intestine. And kaya kailangan mo mag-colon cleanse pag may mga rotten na amoy. Sweat. The smell of sweat is often related to dampness because the fluid-forming sweat comes from the space between the skin and muscles, where dampness often accumulates. Any strong smelling sweat often indicates damp heat. Putrid smelling sweat may indicate a disease of the lungs, liver, or kidney. The sputum, a strong smelling sputum, often smelling rotten, indicates heat in the lungs and usually phlegm heat or toxic heat. A fishy smelling sputum may also indicate lung heat. Pag wala naman pong smell ay ang sputum ay indicates cold. So urine and stool. Foul smell, stool always indicate heat or damp heat in the intestine. Whereas an irregularity of bowel movement and an absence of smell usually indicates a cold condition. As for urine, strong smell urine indicates damp heat in the bladder. Whereas absence of smell indicates cold. Kapag in-interview natin yung pasyente tungkol sa ihi, di ba, tinatanong, anong kulay po yung ihi nyo? Maamoy po ba? Ayan. So may clue na tayo pag sinabing, ay nako, yellow po, tapos grabe po ang panghi. Ayun. Damp heat in the bladder. Panghi po ang tawag dun sa sobrang maamoy. Vaginal discharge and lochia. A strong smelling, lethargic smell of vaginal discharge indicates damp heat. Whereas a fishy smell indicates damp cold. Kasi ang normal, dapat walang amoy. Strong smelling lucia after childbirth may indicate damp heat or toxic heat in the uterus. Intestinal gas. A strong foul smell, smelling intestinal gas. So, indicates po yan ng damp heat sa large intestine. Kung ang gas naman po smells rancid and rotten like rotten egg, so toxic heat po yan sa large intestine. Release of gas without smell usually indicates sphincter deficiency. So, 5 elements. Ito po yung smelling Pag rancid, gotis, fetid, sawod po yan. Pag scorch, burned, fire. Pag sweetest, fragrant sa earth. Pag rotten, rank, rotten fish, metal. Putrid, urine, rotten, so water. So, i-ano po ninyo, mahalaga po itong summary natin. Pwede nyo screenshot. So, others po, strong foul, heat, absence of smell, cold, bad breath, stomach heat, or food retention. So, strong foul smell of stool or urine, so dampit po yan. Pag sour po yung naaamoy, food retention, or accumulation disorders sa mga bata. Foul, pungent, stomach, spleen and stomach dampit po yan. Pag gluten, large intestine dampit. So, thank you po for your attention. Makatulong po sa ating diagnosis yung ating lesson.